This is Travis Rogers of the Dental Innovation Show. I'm here with Kyle Stanley, Dr. Kyle Stanley, one of the co-founders of Pearl. Thanks for joining us.
Yeah, thanks for having me. It's an honor to be here.
So there's a lot of buzz in this industry about artificial intelligence, and you're a dentist yourself. You know, it's kind of one of those misunderstood aspects of dentistry, but it's getting a lot of buzz, a lot of press in the industry. Tell us about Pearl and what makes you guys different.
Yeah, I think what's interesting with Pearl is that we're FDA cleared. So you can take multiple pathologies and actually show them to a patient. So you can build that trust, because I come from a family of dentists. My dad's a dentist, my brother's a dentist, I'm a dentist. But we know that the dental industry, we suffer from having trust with our patients. Even though every dentist, that you know or I know, they're good people, right?
Yeah.
But the patient comes in and doesn't know if what we're telling them is true or not, because we show them, something that doesn't have anything on it. We're showing them just like a gray picture and saying, hey, look at this little splotch.
Yeah.
This means you have to do this, $1,000 treatment. And so having a built-in second opinion really builds that trust. I think the other thing that's interesting with AI and what we're doing at Pearl is we're taking what we see in the radiographs and then cross-referencing that with what's happening in the practice management system. So what I was showing you earlier, we can go through an entire patient and say, or an entire practice, and say, this is what you've treatment planned, but this is what the AI is seeing, and there's some discrepancy. And I think that it's good for us dentists to know that we can make mistakes. We can miss stuff. We're busy. We're injecting this patient. We're doing, prepping a crown. We're talking to our husband or wife. I mean, we're busy and we're humans. And so having an AI assistant to go through all of your radiographs one more time and maybe give you some little insights can be really powerful.
And I mean, I think people are afraid of is this replacing them, right? This doesn't replace them. I mean, it really just increases the numbers, catches those opportunities. Talk about the financials. What are you seeing as far as missed treatment opportunities that are in the radiographs that the doctors are not finding now?
Yeah, so we're seeing in an average like 1 to 2 practitioner office, we're seeing an increase of about $12,000 a month. That's if they don't have any specialty. If you add specialty, that adds another maybe $10,000 a month. What was interesting is what you're saying is worrying about AI taking over. And I always think about, I'm a car nut, as you can see from here, is modern car, you buy a modern car, it has intelligent cruise control. It keeps you in your lane. It makes sure you're a certain distance from the car in front of you, a certain distance from the car behind you, but you still have the steering wheel. You still have the accelerator pedal and the brake pedal, so you're still in charge, right? It's just there as an assistant, and that's how AI is, right? The doctor still has the final say. That's why we call one of our products second opinion. It's this added benefit when you're tired, when you have a disagreement with your colleague. It's there as an added bonus, added insights, both for the patient and for the team members.
Nice. Well, how does our audience get in touch with you?
You can get in touch with us on our website. It's just hellopearl.com, or you can email me directly if you want, Kyle@hellopearl.com.
All right. Well, thanks, Kyle. Appreciate your time, buddy. Great product.